do it at the end or whatever. Stress hormones and brain health. So let's talk about measuring now. I'm going to try and do this as fast as I can. Eric, will it advance? The ultimate biologic response reflects the balance of actions of the different hormones and neurotransmitters with their respective receptors. So I added something in there. You can just add whatever you want to in there. You can add thyroid hormone or whatever. You have to balance T3, T4, and reverse T3. You balance those actions, the thyroid is going to work. Is that kind of how you were thinking? Yeah. Okay, so I'm telling you, this is fast, but it's very deep. Is that you just put whatever you want to in there. But I need to point. All right. You cannot manage what you cannot measure. So we're going to take those through stress also. Nothing is more damaging to the brain than stress. Stress atrophies the entire brain. Nothing is more damaging to the brain than stress. It was so nice I wanted to say it twice. Stress atrophies the brain. We learned this very early on in OB, where we used to give steroids to enhance lung development when somebody had premature rupture of membranes or premature labor. And we used to give steroids over and over again, like every 2 weeks. And we stopped that after a while because we saw it was causing brain atrophy in utero. Anybody remember that, Dr. Pickler? You're not as old as I am. But we found it out very early. And we said, so we were trying to do one thing to enhance lung development, and we were killing the brain. So that's a very early stage. So cortisol or steroids atrophy the brain even from utero. So you got to worry about all of these mothers who are stressed, trying to work and trying to have little kids and then having more kids, that we're having all this autism. And, I'm not saying it causes it, but you got to think about those things. Okay, stress atrophies the brain, and it starts even in utero. Got to figure out where to point this. Other common forms of physiologic stress that contribute to brain degeneration include food intolerances, food allergies, anemia, bacteria. Anything that disrupts homeostasis is a stress. It's not about how much you work or whatever. All of those factors are stress, and they affect the brain. I don't know if you can focus these things better, but hopefully you can look there. But this is another simple diagram that I use all the time. I love this, if you can, hopefully you can see it. But it shows all of these different stressors, and it shows that they all affect the sympathetic nervous system. So emotional strain, anxiety, depression, alpha-adrenergic stimuli, toxic exposure, light cycle disruption, food intolerances, glucose dysregulation, chronic infection, pain, lack of sleep, dietary imbalances, chronic inflammation, neurotransmitter imbalances. All of these are stressors. So whether you are not sleeping well, if you have a food intolerance, all of these are stressors, and those stressors will eventually increase cortisol, and they will eventually atrophy the brain. So stress causes necrosing, aging, and neurogenesis. It's called morphological change in the brain. It blocks synaptic plasticity, so you can't make new connections in the brain. And it affects the neurochemical system, epinephrine, norepinephrine, serotonin, and all of those. Also, it's going to eventually lead to cortisol, and I'll show you that pathway in a little bit. And cortisol elevation can be seen. Eric, we're going to work on this on break, okay? Elevated cortisol. This is salivary cortisol. So this elevated cortisol, and I can show you some much worse cases than this. If that is elevated for too long, it is going to cause problems with brain and memory and those types of issues. Focus. So this is what stress does. All stress is not bad. You need a little bit of stress. I used to give the example, my kids when they were young, they had no stress. Okay, everything was taken care of. And if they had no stress, like going to school, they would sleep until 1 o'clock. They'll still do that. Because if you don't have a little bit of stress in your life, you're not going to perform at an optimal level. You can see at that peak level up there. But when stress gets too high, you cross over into the stress zone, and you become exhausted, panicky, angry, and overwhelmed. And that's where a lot of people are. They're overstressed. And it doesn't, and remember, it's not just the stress of their job or the stress of their family. It's also the food intolerance, the bad food that we eat, the lack of sleep. All of those add to the stress response, and they get us over into the exhausted, panicky, angry, and overwhelmed state. So if you look at this, there's all kinds of things on here. Fatigue, weight change. I will tell you that most of the things that people come in and complain of in your office is on this list. It's sleep deprivation, fatigue, weight change, all of these emotional type issues. There's a study that I often show that 75 to 90% of all visits to primary care physicians are for stress-related complaints or disorder. And if you look at this list, I guarantee you that most of your patients, if you put this on the checklist on your patient triage, you'll be surprised at how many people will check these things off. But what we do, instead of focusing on stress and how to measure it and how to manage it, what we usually do is we give the drugs. We give antidepressants. We give steroids, antibiotics, and antihistamine. We give sleeping pills, and we give anxiolytics. Is that pretty much our armamentarium? But I'm going to tell you what I did was, and what I started doing was focusing on that center thing, stress. How could I measure it, and how can I manage it, and see if there's things that I can do to help without having to use the drugs. So the drugs are only going to calm down the symptoms. The major issue is the stress. Stress disconnects control over primitive emotions. Our executive function gets disengaged, and our fight and flight response get hyperactive. And that's why I try my best to stay calm before I have to give a lecture, because I need my executive function. And if you are stressed, you're going to lose your executive functioning, and you're going to go more toward fight or flight. If the midbrain reticular formation gets bombarded with IL-6 too frequently, it develops negative plasticity for stress. In other words, when stress repeatedly activates the midbrain reticular formation, the midbrain becomes increasingly efficient at responding to stress, so it takes less in order to stimulate the stress response. So if you look at this, stress causes inflammation, and inflammation causes stress. And if you look here, I have it here, cytokines. So cytokines, especially IL-6, will kind of make the brain more sensitive to stress, so it takes less to establish a stress response in these patients. So now this is the point that I'm going to try and get to before I stop. All stress stimulates the sympathetic nervous system. It increases epinephrine and norepinephrine. So if we could measure that information, so if we increase epinephrine and norepinephrine, what do we need to try and balance that out? Serotonin, GABA, and dopamine. Okay? So if we increase this, we're going to have to increase serotonin, GABA, and dopamine. But here's how the body works. All neurotransmitters are made from proteins, and all proteins are made from amino acids. So if you only have, and this is how I explain it to patients, if you only have a limited supply of amino acids, okay, the body is going to preferentially try and make sure that it's able to survive. So it's going to tilt toward the sympathetic nervous system if there is a depletion. I'm going to show you how you measure that. If there is a depletion, it's going to take those amino acids, and it's going to point it toward the sympathetic nervous system, and it's going to sacrifice the parasympathetic nervous system for that. So all of these stressors are stimulating sympathetic response. And so eventually, you are going to have an imbalance of sympathetic over parasympathetic. And there's a way to test it. A healthy brain sends 90% of communication output through an area of the brain called the pontomedullary reticular formation, PMRF. The output stimulates the parasympathetic system, also known as the rest and digest system, which oversees autonomic function. It also dampens the body's sympathetic or fight or flight system. So you need the parasympathetic to hold the sympathetic at bay. When brain function suffers or the brain degenerates, output through the PMRF decreases, inhibiting parasympathetic activity and failing to dampen the sympathetic activity. Chronic stress decreases the firing of the PMRF. So the first thing to go is the parasympathetic nervous system. All right? Now, when that happens, all of the things that the parasympathetic nervous system does is going to get suppressed, and everything that the sympathetic nervous system does is going to get enhanced. And there's a way to measure that. How many people do heart rate variability? I love heart rate variability. Don't you, Dr. Clanner? I love heart rate variability. It tells me if the sympathetic nervous system, because see, the basic heartbeat, if you just took out the pacemaker cells of the heart would beat at 100 beats per minute. If the parasympathetic activity has any effect on it, it will slow heartbeat. It will slow down the heartbeat. It will slow down the heartbeat. If the parasympathetic nervous system is suppressed and the sympathetic nervous system is allowed to act, it will increase the heart rate. So you can look at heart rate variability. You say, well, Doc, what is heart rate variability? Well, is that something new? No, it's been around since the 18th century. And heart rate variability, if you put an F in front of it, is fetal heart rate variability. And that is something that I did for 20 years of my life. And all you're doing is you're measuring the distance between heartbeats. If your heart beats at 60 beats a minute, it does not mean that you have a heartbeat every second. That is the average of your heartbeat over that minute. Actually, the heart rate should vary because every heartbeat is influenced by either the sympathetic or the parasympathetic nervous system. What happens is your body is always looking at the external and the internal environment and is trying to see if it is in balance, if it is homeostatic. If the external environment gets out of balance, let's say somebody comes running in this room screaming something, what are we all going to do? We're all going to look over, we're all going to jump, and if we had a Fitbit on, our heart rate would go up because our external environment has gotten out of balance. And so our heart rate is going to go up, and we would have to say, oh gosh, it's just the person coming in bringing coffee or whatever. And our parasympathetic nervous system would say, okay, we've got everything under control, let's calm back down. All right? If we have a virus or something, what will happen? Your heart rate will go up, your temperature will go up, and your ability to rest and digest, which is the parasympathetic nervous system, is going to get suppressed because you don't want to eat, can't sleep because your nose is running and all this stuff. And after 2 or 3 days, if your immune system is working okay, your body will get the virus under control. You'll be able to eat again. You'll be able to rest again. And your parasympathetic nervous system will come back into fruition. That happens second by second. If your blood sugar is 1 milligram out of balance, it should give you a signal to say that it's too high, and the sympathetic nervous system should recognize it, it should correct it, and the parasympathetic nervous system should come and say, oh, we got that under control. If you don't have enough blood going to your left pinky toe, it should say, oh, we don't have enough blood going to the left pinky toe, we should correct it in the parasympathetic. So you should get this variability. Now, lessons from my past. This is heart rate variability. And we would make life and death decisions based on fetal heart rate variability. If that variability went away and the sympathetic nervous system raised that heart rate up to where it was tachycardia, what did we have to do, Dr. Pickler? We had to fix it. And we'd fix it by cutting off the Pitocin and giving them more oxygen and all that. And if we removed the stress, what would happen? It would get better. And if it didn't get better, and if we didn't remove them from the stress of the uterus, what would happen? We would get sued. That's what would happen. Because we were going to get a bad outcome. And where would the bad outcome usually affect the baby most? In the brain. Because it was under stress for too long of a time without an intervention to remove the stress. So if you don't remove the stress, right, if you have a bad heart rate variability, because this is what's supposed to happen. What's supposed to happen, you should get a stressor. Your heart rate should go up. This was the stressor in the baby. The heart rate would go up, but still you saw the variability. And then it would recognize the stress, take care of the stress, and then the heart rate variability would come back. Okay? This is poor heart rate variability. The heart rate is at 160. Instead of responding positively to the stress, it's responding negatively to the stress. And this is a strip that will get you sued if you don't do something. But this does not change once you are born. And this type of poor heart rate variability will eventually cause organ and system failure. It may take 1 year. It may take 5 years. It may take 20 years. But if you don't do something, that is going to have a bad outcome. So let me get to a couple more slides. This is from the Mayo Clinic review, so you don't think this is some far-fetched thing. Autonomic tone and cardiovascular risk. I just want to show you this real quick. Any factor that leads to inappropriate activation of the sympathetic nervous system can be expected to have an adverse effect on these measures and thus on patient outcome. So anything that overstimulates the sympathetic nervous system, you're going to get a bad outcome, just like we would get. Okay? While any factor that augments vagal tone tends to improve outcomes, insulin resistance, sympathomimetic medications, and negative psychosocial factors all have the potential to affect autonomic function adversely and thus cardiovascular prognosis. So they're really talking about cardiovascular disease. But this is something that's simple. It's fast and deep. Anything that increases sympathetic tone is going to give you a poor outcome. Anything you can do to enhance parasympathetic tone is going to give you a positive outcome. So if we can measure that through heart rate variability, if we can manage it by fixing it and see that the heart rate variability gets better, Mayo Clinic Review says, I don't know what the outcome is going to be, but it's going to be better if you do that than if you don't do it. Okay?